Be late. So, welcome on behalf of the Bluford Healthcare Leadership Institute. My name is John Bluford, and I serve, very proud to serve as the president of the Bluford Healthcare Leadership Institute. The why is this: many people in our communities are grossly underserved relative to healthcare, and they don't have good access to healthcare. As a result, many of those constituents happen to be minority, and they are sicker than majority patient populations. They cost more money for caring because they're sicker. They are less productive in the workplace because they're sick. And finally, they die younger than majority patient populations. And the what is our response, which is the Bluford Institute. And what we've done is developed a 2-week educational, didactic, and experiential experience for young, talented minority students. And I will emphasize talented. These young people are going to be successful in anywhere they go, whatever job opportunities they pursue and or careers. But the goal of this program is to encourage them to come into healthcare. Because I believe in the future, we will only resolve this problem if we have people that look like and are culturally identified to the populations that are underserved.
There are 5 different mandates that list the responsibilities of a federal navigator. The first one is raising awareness. Here, the navigators have to advise the patients on their available healthcare plans. The second one is providing unbiased information. Here, not only do the navigators have to lay out the available plans for the patient, but they cannot state which one they prefer over another, and they have to let the patient decide. Third, assist with enrollment. Here, the navigator does various tasks for the patient, such as making the necessary phone calls, managing their paperwork, and finding a provider. Fourth is providing referrals. And here, the navigator has to refer their patient to any other assistance programs they may be eligible for. And lastly, they have to convey all of this information in a culturally and linguistically appropriate fashion to their patient.
There are several values of the Federal Navigation Program. However, these are the top 3 that we have selected. First is targeted outreach and education services. Many of the people that utilize federal navigation programs might not understand the vocabulary of health insurance plans. They may not know how to estimate their income for the next year, and they may not know who counts as a family member when determining the correct plan. Federal navigators answer these questions along with many others to help the client choose the appropriate health plan for them. Secondly, they provide emotional support, information, and assistance with problem solving. For example, when we visited Swope Health Services, we spoke to navigators there who told us that they assist patients not only with choosing the correct health plan on that day, but they also help months down the line to ensure that they are getting the support that they need. And thirdly, there's an increased rate and reduced waiting time of follow-up. When clients are able to get the correct health plan that they need, they can get timely care in the future.
Creating an efficient metric system to prove the effectiveness of these programs is one of the most important solutions to guaranteeing the success of future navigation programs. It's really quite simple, actually. If there is not an effective metric system to prove their effectiveness, federal government has no reason to continue funding these programs. If federal government discontinues their funding, then that means discontinuation of these federal navigation programs, which leads to more underinsured and uninsured patients.
So how does this contribute to the overall stability of federal navigation programs in the long run? Well, it really is a cycle. If we are able to stabilize one standard metric system, it not only allows the programs themselves to evaluate where they are allocating their time and resources, but they are also able to relay this information to their main source of funding, the federal government. Unfortunately, we found from the Henry Kaiser Family Foundation that from 2016 to 2017, 82% of Navigator programs found themselves with a reduction in funding, some of them up to 80%. Imagine trying to do anything with just 20% of the initial money you were promised.
If running a hospital is analogous to running a business, shouldn't patients receive their money back if they were unsatisfied with their patient care experience as it relates to customer service? Furthermore, how can a healthcare system that commits itself to the compassionate care of patients and families not return the money to those who felt they did not receive the care they were entitled to receive?
An example of one. Geisinger Health System actually implements the money back guarantee. It's located in northern Pennsylvania and serves rural communities by being its largest employer. Also has its own insurance company, which really facilitates them being able to conduct this policy.
So now that we've discussed what a money-back guarantee is, as well as what Geisinger Health System does, we have to look at some of the advantages and disadvantages of offering a money-back guarantee. Keep in mind that one of the main objectives of offering a money-back guarantee is to uphold the integrity of healthcare officials and also to improve patient satisfaction. So that being said, one of the main advantages of offering a money-back guarantee is that it holds healthcare officials accountable because they'll be rated on their performance. We won't have to call into question a healthcare institution that consistently receives negative reviews. Also, it improves branding awareness or publicity. Keep in mind that Geisinger has utilized this opportunity to offer a money-back guarantee as a way to market itself as a hospital with a culture of compassion and dignity. This in turn puts more eyes on the product and gives it more exposure so that we know about what's happening. So now we've discussed some of the advantages, we have to look at some of the disadvantages as well. One of the main disadvantages is that it's extremely difficult to implement at the national level.
Recognize and reward our employees to encourage them to deliver the best customer service. And in turn, we will reduce the need for a money-back guarantee policy.
When we think about caregiving, we not only think about the responsibility that these caregivers have for their family members, but we also think about the integration of stress, the lack of time that they have for themselves because of the amount of time that they're spending on their family members, and lastly, the financial burdens that they face.
So we're suggesting for the sandwich generation, we as college students go to those semi-private nursing homes, the assisted living facilities, and to the adult daycares and volunteer with them and spend time with them so that the sandwich generation doesn't have to be as stressed out trying to take time off their jobs or the travel going back and forth.
We also recommend that employers look into investing in long-term care insurance for their employees. This will create a better employee benefits package and it will produce more productive employees.
There are 5 types of mergers. However, for the sake of time, we will be talking about 2 of them. The first one is a horizontal merger, where the companies operate within the same field, pushing out the same products and services. Companies in horizontal mergers are usually within industries with few firms, as the competition is very high. So by combining forces, they are able to decrease competition by increasing their market shares.
CHI and Dignity Health has come together to say that they are going to dedicate their resources to first retention and to recruitment of the top talent available. Secondly, they're also going to focus on influencing the technologies that are put in place in their systems, investing into Google and many other devices that bring new tools and products to their customers.
Dignity Health's issue is their payer mix challenges. They're focusing on that by helping with the government to provide more provider fee programs. Now we will discuss our vertical merger between CVS and Aetna. Kyle?
One of the main advantages to the consumers with this merge will be the reduction in costs. With 1,100 minute clinics, Aetna can encourage their patients to go into a minute clinic for non-emergency needs rather than an emergency department. This is not only more efficient and effective for the patient, but it's cheaper for Aetna to cover.
So thank you very much, Stuart.